You know, we're hearing all about these financial crises. The big one, no one even talks about. It's the hospital healthcare crisis. Are you aware of that one?
A little bit. I've been hearing a few things about it.
Well, most hospitals are barely getting by. They're working on rates that are probably outdated, out-fashioned by, who knows, 20, 30 years. And the government regulations, which are very costly, they don't pay for it, they have to implement. For instance, the concern about privacy rules. If you had a fax machine and the fax was faxed up, not faxed down, you couldn't use the machine. You had to create a lot of printing for people to sign that you agree they're not going to do and that the standards of practice. This was very costly, and every hospital had to implement it. So no one paid for it, but the government regulates. Some hospitals now, when they get audits from various agencies, they add more and more things they're looking for. No one's giving the hospitals a way to pay for it. So a lot of hospitals who are near bankruptcy are going to be pushed into bankruptcy.
It sounds that the hospital, which is a large business,
And
is in the same dilemma as the individual doctor in his office.
You're right. But a good example is, say, there's a hospital in New York City, one of the private hospitals, and a poor name, but I want to mention the name. Obviously, they attracted many uninsured patients for years. You don't refuse to take care of them because you got money from the federal government to do some construction, Hilton Burton money. You have to take care of them. No one pays for it, so they lose money. So as the crisis gets worse financially, a lot of people are going to lose their health care insurance. They're not going to be able to pick up another form of insurance for months, if not longer, because you have to show you're not making income for a 3-month period or longer before you can justify a child health program or a Medicaid program. So it really going to pick some of these hospitals who are barely getting by that could be put right out of business.
Yeah.
In Staten Island, where one of my practices, a very fine hospital, Richmond University Medical Center, it's sort of like a city hospital. It takes care of all the poor. City hardly helps them in any which way, yet there's no city hospital in Staten Island. So they're functioning as a private hospital with the burden of taking care of, obviously, some patients who are not properly insured or underinsured or not insured. And I'm familiar with the pediatric program. The director is one of the finest pediatric gastroenterologists probably in the whole country. And he does a good job, and he doesn't order a lot of tests that are unjustified. He's not rewarded with extra fees because he doesn't do those things. That's their policy. Take a good history first and only do tests that are properly indicated. This is the way medicine should be practiced.
Right, right.
The places that make money are the ones that do procedures and ask questions later.
Well, we did have 4 hospitals out here. Doctors Hospital is closed, and then there was Bailey Seton. They're not working as a hospital now. Now, there's no other borough that has 2 hospitals on it, like Staten Island.
And we have a population with about 500,000.
It's growing every year. We got the largest land area of any borough. And we have 2 hospitals. And neither one is a public hospital.
So we have a big problem.
Yes.
And the city had a solution. They're going to create clinics for the poorly insured, underinsured. But those clinic patients have to get admitted to a hospital. Where are they going? They're not going to take a $10 toll over the bridge to go to a hospital that could suit them. It's called a city hospital, because that's what it costs to go over a bridge one way in New York City. That's outrageous. And guess what? A poor person can't afford it. So they're going to stay in this particular borough.
Right.
And the reimbursement to the hospitals, according to the new governor's mandate, because the budget is a little bit in the hole, he's going to cut back huge numbers, going to make these hospital situations even worse, because the first cuts in his new budget is healthcare and education.
Well, the chancellor already sent a letter out to the teachers via the Department of Ed website that the city education budget is going to be cut also. So budgets are being cut all around. The tax rebate of $400 a year has been cut out for this year also.
So, in other words, it's a big problem.
It's hurting all over.